in this hour, but we're going to go over a lot of valuable content this evening for what can you bill to medical, how do you bill medical as a dental practice especially, and some tips and tricks along the way as well. So thank you everybody for joining this evening. We have with us Rose Nierman, the founder and CEO of Nierman Practice Management and creator of the Dental Writer software. So as you saw while you were waiting for the webinar to begin, this is our 30-year anniversary. So Rose has a bit of experience in the field. So thank you, Rose, for taking the time to share this wealth of information this evening.
Well, thank you so much, Ms. Courtney. We're really excited about this webinar, Medical Billing and Dentistry 101. And I'll tell you a little bit about our company and what we do. Our company is dedicated to helping dentists bill medical. That's what we do. I'd also like to introduce Ms. Courtney Snow, who started the webinar. Courtney is our Director of Training and Implementation and Support. So she's very similar to me, one of the coding nerds. And so thank you for joining us, Ms. Courtney.
Well, thank you, Rose.
All right, let's go ahead and get started here. All right, so we get this question or this comment all the time when we go to dental meetings. We really want to bill medical to help our patients get the treatment they need. That's the main reason we find offices want to bill. And you're going to see the case acceptance is so much better, obviously, when the patients have some help from their medical insurance. So the big question is, where do we start? Well, that's a great question, and that's what this webinar is for, to get you started on the answers to that question. Now, keep in mind, billing medical insurance for medically necessary procedures has many advantages. And those two words that you see in the middle are key words, medically necessary. You'll be hearing that throughout this webinar this evening because that's what the insurance companies are looking for, and that's what we want to show you how to demonstrate. So the Nierman Practice Management, as Courtney had mentioned, we've been in business for 31 years of empowering dental practices with world-class solutions for medical billing, dental sleep medicine, TMD, and oral surgery. So that's the purpose of what we do and the purpose of this webinar as well. So again, thank you all for joining. A little bit about Nierman Practice Management. We do have solutions, as I mentioned. That's our mission, is to provide solutions for dentists and their teams wanting to bill medical. The main solution that you may have heard of, and some of you are using Dental Writer, is the Dental Writer software, which I'll demonstrate to you or explain to you whether you use a software for medical billing or you do it by hand. It's important to have a system for your documentation. And so we'll talk about that, whether you're doing it yourself or using a medical billing service. We also have a cross-coding hotline, which is available for any of those burning coding questions. We have Unlocking the Code seminars, medical billing for dentistry, cross-coding seminars. We also find many dentists love our DME application service so that you can become a durable medical equipment supplier, and that means you can bill Medicare for oral appliances. And as you may have seen when you signed up for the webinar, we offer clinical treatment for TMD and dental sleep medicine as well. So that's in a nutshell what we're here for. So when I give the cross-coding seminars, Courtney's very aware of this, all of a sudden I'll break out into the statement, there's a code for that, okay? Because there's a code for everything that a patient comes in with, or an accident or an incident, and anything that you see when your patients come in, there's a code for that. There's also a solution for that when it comes to medical billing. And the solution starts with, what procedures can we bill to medical? Okay, what are commonly considered by medical insurers? Well, exams and office visits. If it's a procedure, a service, or a diagnosis that is covered by medical, they'll pay the exam, the screening exam, and typically follow-up office visits too. Also, any of your imaging, including a panel, CBCT, tomography. Again, if it's a condition that the insurance pays as medically necessary, they'll typically pay for the x-rays too. Temporomandibular joint disorder appliances, trigger point injections, adjustments to those, any type of TMD is commonly paid by medical insurance. In fact, there's 40 of the states have a mandate that a TMD has to be covered under medical insurance. And it's, I think, Courtney, would you agree that's probably the best kept secret out there?
Absolutely.
Yes. And so that it's important to know if your state has the mandate, which we have done the research on it. And if you just email us at contactus@dentalwriter.com, we can send you information on your TMD mandate. But even if your state doesn't have a mandate, then it's based on medical necessity. So it doesn't mean you won't get paid if it doesn't have it. But the fact that there's so many mandates out there, most of the states, that it is something that you should be billing to medical. Of course, the sleep apnea appliances are very predictable through medical. The great news is with sleep apnea appliances, typically you can pre-auth, you can know in advance if they're going to pay, and as long as you have your ducks in a row and have the right documentation, you should routinely get paid for your sleep apnea appliances. Another common procedure would be, of course, the bone grafts, sinus lifts. Those are definitely picking up recently in the last couple years. I'm seeing more and more medical insurance companies paying for bone grafts to an edentulous area, or if there's a defect, a bony defect, bone grafts as well for that. And often, they'll pay for the implants too. If you can show there's bone atrophy and it's medically necessary. And when the patient has a symptom where they're compromised and they're having difficulty with function, okay? There's even a code for removal of implants. Extractions are typically paid, especially if they're impacted. It seems like the insurance companies either just have a policy for or against impactions, against paying for that. If you look at the policies, and you'll notice that they say if there's a lesion of radiolucency, something, an infection around it, that's going to up your chances of getting paid for those extractions. So as we go through this evening, you'll see it's all about having that right diagnosis and being, carefully documenting everything that you see so that you can show medical necessity. And recently, Courtney had put together a pediatric ortho and airway a study group. We did that, a couple months ago, Courtney, I think?
Yes, ma'am.
Yeah, and that's exciting because we started noticing and hearing from our clients that that's picking up with medical insurance. And many of the policies recently have come out with, okay, this could be medically necessary. So we'll talk about how to document that. Mucositis, for those patients who are undergoing chemotherapy or radiology treatment, it's a good use for your laser. We finally found a way to get the laser treatments reimbursed with medical. again, it's kind of exciting because just in the last couple years, I've been doing this, well, at least 31 years. I started when I was, the old started when I was 12 joke, right? But we're starting to see more and more things being included in the medical policies. Frenectomies is something that you should consider to medical. Of course, biopsies you'll want to send to medical. Any type of oral surgery, in IND, medical clearance exams. So if a patient referred prior to having a surgical procedure, just to make sure there's no oral infection, typically the insurance medical will pay for that exam and any imaging that you take during that appointment, especially a simple x-ray such a Panorex. Now there are codes for anesthesia and moderate sedation. Moderate sedation's doing a lot better than it used to. A couple of years ago, they came out with new codes for that. So at the seminars, when I bring up, well, are you sending your accident cases, your broken teeth, missing teeth due to accidents to medical? I always look out in the group and I see many of the participants are like, oh, I should have sent that case to medical. And so you should be sending your accident cases to medical insurance as well. And the last but not least, and there are more things, this is just an outline of different things, is medical has started to pick up and pay for Botox with the diagnosis of jaw pain or painful bruxism too. So we've got some more information on that and how to make it happen. But the important thing is that when you're billing medical, you're going to save the dental benefits. Dental benefits are typically limited to, say $1,500. Medical doesn't have that yearly limit. So when I call the medical insurance company, they'll say, yes, there's a limit to the policy. It's $1 million. It's medically necessary. And I'm like, well, okay, I can stay within that. So, if it's treatment such as a crown or, just a routine dental visit, then of course that's going to be dental. So I want you to, feel at the end of this webinar that you'll know when to determine if it's medically necessary or if it's dental. So we're also seeing that it's becoming a necessity to bill medical. Dental insurance companies are now denying claims due saying, well, we'll look at this after you file the medical first for anything that's surgical. So I'm sure many of you on the webinar have seen that, where the insurance dental will say bill medical first and then send the EOB with the claim, either showing that they paid it or denied it. Okay. Now, another important thing with billing medical and getting started with this is to become aware of the different medical policies. Medical policies are available. You can actually find them online. In fact, if you do a web search for Aetna, medical services provided by a dentist, you get 4 or 5 pages explaining what's covered and what's not. So very important to be aware of the different medical policies, whether it's Blue Cross Blue Shield of your state or the other top medical insurers such as Aetna, United Healthcare, Cigna, and so on and so forth. But in there they'll state, okay, we cover dental examinations to detect infection prior to surgery. Anytime you take diagnostic x-rays for services that are covered in the medical plan, yes, we'll cover those. And treatment of oral infections is, that statement is in almost every medical policy there. So that's probably the second best kept secret other than the TMD. So this is definitely, something that the policies will spell out. which is nice because the policies will spell out what's covered and what's not covered. Sometimes they'll even list the codes in it. Now, there's been a huge growth in medical billing and dentistry. I have a great example. Courtney, you found these stats recently. Isn't that just amazing what we're seeing as far as the growth on oral appliances? And this is something that we don't have the stats for 2018 yet, but you can see in 2014, 24 million was submitted for the code E0486 for the sleep appliance. In 2017, it's gone up to 65 million. So just snowballing. And we're definitely seeing huge growth in this area. So what do you need to bill medical? You need the benefit verification. Your first step is always an insurance verification. You'll find out from the insurance, hey, do they have coverage or not? Do they have insurance, okay? You want to find out if it needs to be pre-authorized. You're going to need your diagnosis code, your ICD diagnosis code, and your CPT procedure code, and the medical claim form. And very important is having your narrative report, or what we call your SOAP notes, showing the subjective, objective, assessment, and plan. And again, knowing the coverage criteria will go a long way in knowing what the insurance company wants, so we can give that to them at the get-go before they have a chance to deny it. So medical coding, there are, of course, ICD-10 diagnosis codes for classification of diseases. We also have the CPT procedure codes for current procedural terminology. And HCPCS codes are another level of CPT codes that are for devices, equipments, or supplies. And then there's something called modifiers that are very important, because the modifiers show that the CPT code has changed in some way. That, you know, why don't you give us a good example of a modifier, Courtney?
Yeah, you know, one of the, I think, most common ones that we see in medical billing and dentistry is the modifier NU. You know, modifiers are 2-digit or 2-character codes, and NU stands for new equipment, meaning that this is a new piece of equipment or oral appliance, and it's not refurbished or reused.
Yes, and so those are very important, because the insurance companies simply won't pay without having that. And, you know, I'll give you the opportunity to explain what the ICD codes mean and what they matter, because they're so important to billing medical.
Absolutely. So ICD-10 codes, you'll see ICD-10 because we aren't on the 10th revision. If you stumble across any ICD-9 codes, please know those are no longer in use. But diagnosis codes matter so much in medical billing, because they are the why are these services being provided. These codes are going to be entered into box number 21 of the claim form. We've got a nice little example on the slide here of a sleep apnea appliance where the patient has been diagnosed with the code G47.33, and that stands for obstructive sleep apnea. So that's the why we're doing the services. The patient is diagnosed with this condition. Every medical claim requires at least one of these, and that's the big main reason they're important, but it does allow up to 12. And another thing you may run into, or you may have already, is some dental insurers actually are requiring ICD-10 codes on your ADA claims. So all wonderful reasons to pay attention to your diagnosis codes.
So why do CPT codes matter? Well, they show the service you provided, what happened, or the service the patient got. Those are your money codes. And in order to bill medical, every medical claim requires at least one, and allows up to 6 on the claim form. So as you can see from this graphic, the 99202 is an exam. That's a new patient level 2 exam. That'd be, be about, 15, 20 minutes. And the one under that, 70355, would be a Panorex. Okay, so it's really, once you break down the medical claim form, you can see in section 21, you've got your diagnosis codes. The diagnosis is going to show why the patient's there. And then the procedure codes show, okay, this is what we did. And it's very important to connect the ICD diagnosis codes and the CPT procedure codes. Because the ICD diagnosis code should establish the medical necessity of the procedure you're performing or the equipment you're supplying. In other words, the treatment should be appropriate for the diagnosis. For instance, this is a good example of that. This is actually in section 21, TMJ, Arthralgia. In 21A, your second diagnosis is bilateral articular disc disorder, and last but not least, number C would be your jaw pain. So because of the TMJ disorder, the patient has jaw pain. So you can see how diagnosis codes tell a story. And sometimes it's helpful to have more than one so that you can have the condition and the symptom. You can also see here in the highlighted area in 24E that it references back to 24E diagnosis pointer, references back to section 21, stating this service relates back to all three diagnoses, A, B, C. So very important for everything to match up and correspond. Another thing important, very important, is to avoid dental lingo. Use medical lingo when it's medically necessary. It's not that you're trying to tell it, say it's something that isn't. It's just the appropriate medically necessary language. Couple good examples, an oral device would be preferable through over a dental appliance. Of course, if you call an occlusal guard or bruxism guard, that type of service, that's going to be considered dental. If it's truly a TMJ orthotic, then you want to call it a TMJ appliance or orthotic. Orthotic's the best word for your TMD. And on this is important, if you call the insurance to get an insurance verification, a benefit check, and you say, we're doing dental implants, is this covered under medical? And they'll go, let me put you in the dental department. Now, a big difference between that and saying, we are providing medically necessary oral implants. So you can see how important it is to use the proper lingo with medical, whether it be in your conversations or in your SOAP narrative reports. And so I think you're getting the drift. Medical necessity is what gets coverage. And it's all about documentation. You've heard location, location, location. With medical billing, it's documentation, documentation, documentation. And we wouldn't want you to miss out on reimbursement because your documentation is lacking. So to set yourself up for success, at first, are you determined, are you going to file your own claims or are you going to outsource it to a medical billing company? Determine how you're going to collect the medical history taking for medical necessity and document that, as well as how you're going to document a medically necessary oral screening or exam. Also, of course, it's important to, get your ducks in a row, decide who's going to perform the benefit verification, pre-auth, and, of course, finding out all the ins and outs about how to complete and file a claim. And this is all the information that we go through, too, at our cross-coding seminars, as well as our remote trainings, too. So as you can see, documentation is going to make or break your claim. The documentation shows, because this patient came in with these chief complaints, and we did this exam, and we found these, lack of function, that or a diagnosis is medically necessary, and here's the plan. So because of the symptoms, that's your starting point. SOAP, Subjective Objective Assessment Plan. Now, since you're generating that narrative report, that SOAP report for medical insurance, send that report, of course, with the patient's signed permission to the patient's other healthcare professionals. So this is typically your highest source of new patients if you communicate this way, and gets the word out you're the guru in your area. Now, also, I imagine most of the team and dentists on this webinar are going to be billing out of network. And keep in mind, 95% of the dentists that we work with do bill medical insurance out of network, so that's perfectly fine. Some of them have gone in network for these procedures with medical insurance. It's not necessarily that easy to get in network. So because being a dentist, but in order to bill Medicare, you definitely want to become a DME supplier. And Nierman Practice Management does have an application service for sleep appliances too, so that you can become a DME supplier. So it's something to think. I would suggest you start billing out of network. You're actually going to receive a higher payment for out of network than if you go in network. And again, that's what most do. But it's something you can consider down the line. Now, Courtney, are you seeing some medical insurance require credentialing too?
Yeah. You'll run into, as an out-of-network provider with many medical insurers, they don't necessarily have a specific process or application process you need to go through to go ahead and start billing them out of network. Many of them will just say, hey, send us a copy of your W-9 with your first few claims. However, you will run into insurance companies, many of the Blue Cross Blue Shields especially, that will want you to fill out some paperwork, basically, in order for them to accept your claims. They'll want you to register your NPI or your doctor's information with them. So some insurers will have specific forms that they have generated that you can sometimes find on their website, or you can request a copy to be faxed or emailed over to you. And then some of them will actually work with organizations like the CAQH, which is a database, basically, that you can enroll with that houses credentialing information. So if your practice has not yet explored CAQH, I jump onto caqh.org and start exploring.
So let's go through the medical billing process. We want to make sure that you have all the steps in place. Again, starting with that benefit verification, this is the key information that you'll get. Really, it's to find out if there is any coverage at all, if the policy is active, what the deductible is, and they will tell you what amount has been met, what the co-insurance is. Very important, and again, I ask this many times, is a pre-auth required or pre-certification or pre-anything? A gap exception, if you're out of network. Gap exception is a one-time permission to use their in-network benefits, which can lower the out-of-pocket costs for the patient because their in-network co-payments might be less. So this would be, the gap would be, let's say there's no one within a 30-mile distance of the patient's residence who does the exact procedure that you do, who's in network. We can ask for an exception in the plan because the insurance does have to provide the treatment to the patient. And so that they might, I'll go ahead and say, okay, there is a gap in our provider network. We will let you the patient can use their in-network co-payments. Also, you want to find out if they do have out-of-network benefits, and they'll tell you, they go through the list and tell you all this, if there's any exclusions and out-of-pocket max as well for the year. What that means is once the patient's paid a certain amount, then the co-payments, maybe like $10,000, the co-payments then start paying at 100%. Now, once a pre-auth if you find a pre-auth is required, most medical insurance companies do that by fax. So you can start the benefit check by phone and ask if a pre-auth is needed, and you'll get a fax number to send the documentation to. There's no place on the medical claim form to check that this is a pre-auth. So that you can send the claim form in with the words pre-authorization over the dates of service, but you're going to need your SOAP report of medical necessity with it and any other documentation that they might need. And in that report, there'll be the chief complaints. If there's any pain, the history of the pain, any accident history, medical history, exam findings, your diagnosis codes, procedure codes, and your treatment plan. And again, that's where on that benefit check is where you can also say, okay, if we want to see if the patient can use their in-network benefits, that's when you're going to ask that as well. Okay. As far as filing medical claims, it's always best to file claims electronically if at all possible, although many medical insurers will still accept paper claims. This is the medical claim form referred to as the CMS 1500. As you can see, it's similar to a dental claim in that the top portion is the patient information. The biggest difference there are 12, up to 12 diagnosis codes that you can use. And then your procedure codes go in section 24. So the key is to send info at the get-go, at the beginning, so they don't have a chance to deny it. You can see where we're going with this, just to get everything, figure out everything that they want and just get it to them. However, denials do happen, but keep in mind denials are not written in stone. And you do need, documentation, very important to appeal as well. Large percentage of denials that are appealed or overturned, very large percentage, and paid upon the first appeal. This was an actual study that was done that if you send a written appeal, it's way more likely to be approved than not. And I think that, a lot of people throw up their hands when it's denied and don't appeal it. But if you do, it's well worthwhile. Now, the other thing that you want to make sure that you have in your office is a treatment-specific questionnaire. And that way you're asking the right questions, whether it's oral surgery that you're performing, TMD, or dental sleep medicine. As you can see, we're asking questions that, is this affecting the patient's function? Is your diet limited to semi-solid or soft foods? That's an important one. Do you have difficulty chewing, speaking, swallowing, facial pain? There's even an ICD code for, having an easier gag reflex where they can't wear removable. And of course, your head pain diagnosis is going to come in quite a bit with many of the procedures you're going to be billing, as well as your jaw clicking, loss of teeth, mouth sores. Anytime there's numbness or tingling, that could be neurological, so that gets their attention. And a comorbidity of many of these conditions are nutritional disorders. But anytime there's pain as well, that's going to come in. So have a treatment-specific questionnaire so that you can determine, is this a medical necessity? That's the Nierman Practice Management has treatment-specific questionnaire and corresponding exam forms, and this is a sample of the oral surgery implant, or just the general one for the general dental practice too. This is a copy of using the medical model type questionnaire for your temporomandibular joint disorders, very treatment specific. And you're, again, look at these symptoms, you'd be hard pressed to say this is dental. This patient is in pain. And there's also a sleep history questionnaire exam and workup with all of the questions that they want to have answered about the need for an oral appliance too. Additionally, Nierman Practice Management has orthodontic questionnaire and exam and the periodontal questionnaire and exam too. So they all match up. So you saw some of the questionnaires. This is a great example of the information the insurance is going to want from the exam too. This has been used by thousands of dentists since 1990, and you can see it walks you through the whole airway exam and the all of the exam findings that they're looking for too. So the Nierman system reimbursement processes and tools involves the questionnaire, having a treatment-specific exam for medical necessity, generating your SOAP narrative report, and then generating your medical claim. Okay, and that's, as I mentioned earlier, what the dental writer does. A patient can fill out the questionnaire even online. The exam data is entered. Step 3, it automatically, from the findings from the questionnaire exam, generate that narrative report, and then it prepares the medical claim. Let's talk a little bit more about the SOAP report. The subjective would be, of course, the patient questionnaire. What symptoms are you having? What pain are you having? What problems? The objective would be your exam findings, typically based on maxillary and mandibular findings, not as much, tooth-related findings, but depending on what you're doing, very much toward the maxilla and mandible. Now, the assessment part of SOAP is your diagnosis. And make sure you print not the ICE codes. I just changed the slide right before, the ICD-10 codes in your assessment. So it's important to print those diagnosis codes and your plan. And in the plan, print your CPT procedure code. So all that's your narrative report documentation. In addition to having what they call your clinicals, which is your SOAP or your narrative report, you want to make sure that you do supply any other documentation that's required for it to be medically necessary. This is an example of if the patient has mild sleep apnea, AHI, or RDI equal to 5, equal to 5 and less than or equal to 15, so 5 to 15 AHI. The patient also has to have any of these symptoms. Okay, so apneic episodes, hypertension, excessive daytime sleepiness, history of stroke, impaired cognition, insomnia, ischemic heart disease, artery disease, or mood disorders. So you can see where your documentation is important, including a copy of the sleep study if you're billing for a dental sleep medicine. That will be required too. So now we talked about solutions and documentation and getting started. Let's talk about codes. There's definitely a code for that. These are your codes for your office visits. There are 3 sets of office visit codes called evaluation and management codes. The first set are consult codes when the patient's been referred to your office for a second opinion. So requires a referral from another healthcare provider with a report back to them. Now, you'll be using the new patient codes, probably even more often than the consult codes. And though there are actually 5 levels, but with the dentist, we recommend a dental practice that stick to the level 1 through 4. Because once you get into the level 5, that's more for a patient where a physician's managing several diseases and many comorbidities. Now, so we'll talk a little bit more about that, but your level 1 would be like your 10-minute exam. Your level 2 is going to be, 20-minute, level 3, 30-minute, and level 4, 40-minute or more. But they're really not looking at how much time you spent, what documentation do you have to show you qualify for this level. So, some of the reports we showed you, you can, get up easily, to a level 3, because if you take that treatment-specific questionnaire and exam, it's very, very detailed medical history taking and exam. And then there's a set of codes for established patients as well. Now, these are your codes for radiographs, whether it's a Pano, FMX, you've got your cephalometric, which is called a lateral skull, tomography, and there is a code for CT scan and CPT code as well for a CT follow-up. So that's where you get started. You're going to build that exam, you're going to build those x-rays. Then you're going to determine, okay, let's say this patient's had a sleep study. On the sleep study, since dentists don't diagnose sleep apnea, once you see it on the sleep study, you can bill it. And there's only one diagnosis code for OSA, G47.33, whether it's adult or pediatric. There are other sleep-related diagnosis codes, snoring, other sleep disorders such as upper airway resistance syndrome, and sleep-related bruxism too. Now, typically, we're not seeing them pay on snoring because it's, again, not medically necessary. They have to have at least mild sleep apnea. But that doesn't mean there's not a code for that. Now, so we got our diagnosis codes, and we mentioned how important the ICD-10 codes are. The oral device is E046, and that's going to be your HCPCS code, again, which is second level CPT code that shows this was a device, okay, or equipment. So the only code we're seeing medical pay on for the sleep appliances is E0486. And as Courtney mentioned, the NU modifier for new, okay. Now there is a code for a prefab sleep appliance, but it's typically not covered. Now, let's look at some more diagnosis codes. And again, that's, once you get that questionnaire and exam, making the diagnosis and assigning a ICD diagnosis, ICD-10 code to it is your big key to success. So there are many codes for your TMJ disorders, whether it be adhesions and ankylosis, arthralgia, and they are categorized by right, left, or bilateral. Articular disc disorder, very, very common to see medical pay on this set of coding. But that by itself, let me go back, if you have a patient who came in with articular disc disorder, but that's your only code, ICD-10 code, that might not be medically necessary. But if you have a secondary diagnosis of R51, which is headache or head and facial pain, now you've got medical necessity because of this TMJ disorder, the patient has head pain. And what's really exciting is that 2 codes were added to the ICD-10 for 2019. At the end of 2018, they were added. And so they're actually bringing out more codes for dentist billing medical, which is extremely exciting. So the new codes are myalgia of the mastication muscle and myalgia of the auxiliary muscles of the head and neck. So we're excited about those. So again, we've got the codes, we've got the diagnosis codes. It's helpful if you can look up the policy devices. According to this particular policy, they are eligible for coverage. But then again, it says when covered under the member's contract. So you want to, again, do that benefit check just to see what their policy states. And it's all about medical necessity. So the CPT codes for your oral orthotics will be insurance specific. And don't forget, again, your narrative report of medical necessity. Don't wait for them to ask it. Send it with the claim. So we do, thoroughly go over all these codes in our cross-coding seminars too. Also, if you're doing trigger point injections, there are codes for that. So definitely, and it is something we typically are seeing medical pay on, at least for now. Now, let's say you have a patient who's missing teeth. You're not going to bill the bone grafts and implants under the missing teeth codes because that's not what's causing the dysfunction. You want to code what's currently there. And so now I'm going to code for atrophy of the mandible and maxilla, whether it be minimal, moderate, or severe. And also once let me just go back really quick. Okay. The bone grafts will go with the atrophy codes. And again, an atrophy code, let me just go back, by itself is not going to show medical necessity. Patient has atrophy, that doesn't necessarily mean that there's loss of function. But if you have any of the symptoms, we talked about, or conditions, now you've got medical necessity. So it's not uncommon to have more than one ICD-10 code to show medical necessity. And then once you get that diagnosis code determined, then you can bill for your bone grafts. And those are categorized into either maxillary or mandibular, okay? And you can also bill for your implants too. Also, there's a diagnosis code for failure of implant. So whether it's osseointegration or biological failure, there's a code for that. Okay. Additionally, you saw in the policy at the start of this session, the cellulitis and abscess of mouth codes are very, very commonly paid. So these are diagnosis codes, again, to show the reason the patient's there, whether it be cellulitis and abscess or a non-odontic genic cyst. And then, once you figure out, okay, what's there, if there's an abscess, you're going to have your codes for that, your procedure codes for the incision and drainage, okay? Neoplasms, okay. That's a really big section of the ICD-10 book because there's so many benign, malignant, or neoplasms of uncertain behavior. So we'll just kind of see, depending on where they are, it's going to be coded differently, whether the floor of the mouth or the lower jawbone. Okay. And again, they just, there's many neoplasm codes, typically depending on where it is in the mouth. So they get very specific as far as diagnosing that. Okay. As well as neoplasms of uncertain behavior, depending on the locale. So once you have that, neoplasm and you're doing a biopsy, we've got your CPT codes. Again, it's going to be based on where the biopsy was performed. Okay. Anytime, if you do an excision, that's something typically considered by medical. There are many excision codes for the dental alveolar structures as well. Now, as we mentioned at the beginning, there is a diagnosis code to bill your exam and x-rays if the patient comes in for a clearance exam. Z01818, used if the patient needs that consult prior to radiation or surgery. Oh, and these came out, 4 or 5 years ago. The ICD-10 came out with codes for diabetes with periodontal disease. So it's great that the ICD-10 makers are recognizing the oral systemic connection. Now there are codes for that. it's the World Health Organization who actually puts together the ICD-10 code. So that's really, really cool that anytime there's a new, condition or disease that the WHO comes out with ICD-10 codes. So, let's say you have a patient with congenitally missing teeth. There's codes for anodontia as well, and medical codes for tongue tie, feeding difficulty, or even difficulty with speech. So you've got your diagnosis codes are available. We're starting to see policies pick up on if you have an infant who has difficulty feeding or a child with a speech disorder. Some of the policies are now saying, yes, this is a true medical necessity. So I would think the ability to eat, certainly would be. So it's really, a lot of the practices we work with are very excited where they've approached the pediatricians and said, okay, we've got the laser. We do this for the infants who they're having trouble feeding. And they've actually built, quite a nice side thing. And it's just so rewarding to help the mothers and the babies. In fact, this is a policy that Aetna considers lingual frenectomy for ankyloglossia medically necessary when newborn feeding difficulties or childhood articulation problems exist. And that brings us to, speaking of pediatric, child airway. And just in the last couple of years, we've started to see the policies pick up and say, yes, we are starting to consider this medically necessary. The research is out there. The ADA came out and said, this is something everyone needs to look at. And there are codes, diagnosis codes for that. Here's a sample of something you might use with a child of the major anomalies of jaw size, diagnosis codes for that. And they actually state in this policy that they will consider functional orthopedic appliances medically necessary if the patient has a craniofacial anomaly, especially if they have signs and symptoms of OSA. Now, any of you who are doing billing for medically necessary orthodontics, you do know that's part of the Affordable Care Act in most states, that it must be covered. So these codes have come up to the forefront because if the patient doesn't have dental insurance and it is a mandate that medically necessary ortho has to be paid, then that's an opportunity to actually use these codes with medical, whether it be the malocclusion or hypoplasia, microgenia, and so on and so forth. So as you can see, there's certainly no lack of, this is just a few of them. So it's exciting when you start seeing, okay, this is something that I'm seeing in my patients, and we want to be able to show medical necessity, and then that starts with your code and your documentation. So again, some more orthodontic codes. Open occlusal relationship and anomalies of dental arch relationship. So we do see that, we're kind of, working in this webinar with the Aetna plans because they're actually really good at publishing their policies. But they're stating comprehensive medically necessary orthodontic services are covered for cleft palate, of course, trauma, of course. But the third one, skeletal anomaly, I can say it, anomaly, involving maxillary and mandibular structure. So, okay. Now, as we mentioned, we are seeing some insurance companies pay for mucositis if the patient had radiation, anti-neoplastic therapy, and chemotherapy. So there are opportunities for that as well with medical. In fact, this particular policy says the laser meets the therapy meets the definition of medical necessity for prevention of mucositis or treatment of it in members undergoing chemotherapy and or radiotherapy. Okay, so we're starting to see some great progress. Accident cases, there are thousands of codes to describe accidents, whether it's a fall, assault, sports injury, the list goes on. So with an accident, you want to gather as much detail as you can about how it happened. And then there's a code for that. Fall on same level from slipping, tripping with subsequent striking against object. Okay. Driver injured in traffic accident. Displacement of teeth. So the teeth might not be missing or fractured from the accident, but they might be displaced. So there's a code for that. And for the patient who comes in with a traumatic fracture, there are specific codes, whether it's closed or open. As well as partial loss of teeth due to trauma that you can use for trauma cases too. Okay. And again, we mentioned that, many times you'll see extractions paid for, so you're certainly going to want to make sure that you have your codes for impacted and embedded teeth as well. So there are, thousands of diagnosis codes. There's hundreds of procedure codes for the dental areolar structures. And so it's, definitely many opportunities. The moderate sedation codes, again, are based on if the patient's younger than 5 years of age or 5 years and older, based on 15 minutes. Botox, all right. So what did you say, Courtney, in the last 3 or 4 years, we've started to see policies that will pay for them, Botox for painful bruxism?
Yeah, absolutely. It was really unheard of before that. We always kind of considered Botox the conditions that are treated outside of the dental practice or the cosmetic ones that we all know and love. But yeah, it's very exciting. In the last few years, we have seen specifically Aetna list Botox as a covered procedure for painful bruxism. And we'll see, like you mentioned earlier, jaw pain mentioned, or disturbances of salivary secretion if that's a treatment you offer, as well as migraines. Now, of course, there are going to be some stipulations around migraine coverage, and it all comes down to that documentation.
Yes, I know with migraines, they have to show they've been on 3 different types of migraine medications, and so it's a little easier to document it with jaw pain or even the bruxism. Now, basically, TMJ orthotic, you wouldn't use the bruxism codes, diagnosis codes, because they would consider that dental. But it is something that they've suggested that might be paid for Botox for painful jaw pain or bruxism from the painful bruxism. The neat thing about Botox is you can bill the Botox itself too. So you're actually going to bill 2 codes. You'll bill the service, the injections, and the actual toxin as well. So tying it all together, first you want to identify the procedures you can build a medical. Definitely choose a software system to keep you organized and help with coding claims and communicating with other healthcare professionals. Consider additional CE courses for medical billing and dentistry, and ensure someone is responsible for the medical billing process, of course, in your practice. We're here for you. We have many solutions. That is because of the wide range of solutions, we want you to be able to practice your way, practice the way it works for you. And so we do have the options for medical billing in dentistry, whether it be the dental writer software. There's a really good, we have a forum, dental writer forum with FAQs on medical insurance for the dental practice, cross-coding hotline, as well as medical billing support, the Durable Medical Equipment Medicare application service, study clubs, cross-coding seminar, and we've got a wonderful lecture presenter, our main clinical director, Mayor Patel, as well as some other practitioners give amazing TMD and dental sleep medicine clinical seminars, including residency, several session TMD, and then there's a sleep residency too. So we've got solutions for you. Dr. Patel is very renowned in his knowledge in TMD and sleep, and so not only the study clubs, but the seminars. And also, I hope to see you at a cross-coding seminar sometime soon as well. We've got several still coming up this year, and so we try to get around to make it convenient for you. We're here, right here in Jupiter, Florida. That's our home base, and so that's a wonderful place to come to, South Florida. But if you're not wanting to travel, we've got many other locations as well. All right.
Well, great. Thank you so much, Rose. And I know you just said this, but I do really want to encourage every single one of you, if you've not yet come to one of our seminars, they're really something else. And if you're unsure, just jump on Google or Facebook, and you'll find lots of video testimonials from real people who have been there. So I digress, and I do want to open up just for a few minutes here. I know that it's been a long evening, and we've covered a lot of wonderful content here, but we do have a few questions that have come in through the chat box and the Q&A box. So we're going to address just as many as we can in a few minutes here, but please, if we don't answer your question this evening, feel free to email us at contact@dentalwriter.com. And if we have your email here, we'll be sure to follow up with any we're not able to get to. We do have quite a few, so we're going to get through just as many as possible. Rose, great question to kick off the Q&A session here. In order to get a claim paid for a sleep appliance, do they require a sleep study?
Absolutely, yes.
Great.
The sleep study, as I mentioned, will show the AHI, apnea hypopnea index. That's how many times they stop breathing per hour. And it's going to determine if it's mild, moderate, or severe sleep apnea. And so, yes, they will need to see the sleep study. Commercial carriers will need to see a copy of the sleep study prior to reimbursement.
Great. Thank you, Rose.
You're welcome.
Next question. Do you see nitrous oxide as something medical insurance offers coverage for?
That is something that is usually considered bundled into the procedure. There used to be long ago a code just for nitrous oxide, but for some reasons along the line it disappeared. And they pretty much bundle a lot of that sedation into the moderate sedation codes now.
Great, thank you. Another great question here. Rose, what is the best way to submit a pre-authorization to medical insurance?
Well, that's a great question, because as I mentioned, the medical claim form doesn't have a place to check that it's a pre-auth. So what we recommend is have your documentation, and on top of all your documentation can be your SOAP narrative report showing medical necessity. You can include a claim form with it, with the words pre-authorization written over the dates, but they won't know what to do with it if they don't have the documentation. Now, most medical insurances do their pre-auth by fax, and so if you start the process by phone when you do your insurance check, eligibility check, then you'll get a fax number and send all that documentation to them via fax.
Great. Thank you, Rose. Next question here. Regarding gap exceptions, is a gap exception something we should do on every patient, or how does that work?
You know, that is something that should be a case-by-case basis. In fact, Courtney, if you want to kind of go through when you, and because I know you talk to our dentist that we work with just extensively about this. So could you just spend a minute or two explaining when you might, and there's times when you don't want to ask for it too.
Yeah, absolutely. Excellent point. So yeah, and great question. So with a gap exception, there's going to be certain situations where it's going to be very beneficial for you and the patient. The main situation that you want to consider a gap exception is going to be if you are an out-of-network provider with the medical insurance you're working with, and the patient only has in-network benefits available. Many HMO plans are set up that way. So without a gap exception, which means asking the insurance company to honor the patient's in-network benefits, even though you're out of network, without a gap exception for a patient that only has in-network benefits, there is no coverage. That's going to be the main situation. You'll also run into some situations where the patient actually may have both in and out of network coverage. However, if the out of network coverage is going to create a significant out of pocket for the patient, you may be able to lower the patient's out of pocket costs with that gap exception. Of course, typically in network, we have a lower deductible and we have a higher coverage percentage. So there's going to be certain situations, as Rose mentioned, where maybe the gap exception isn't the best choice. For example, a patient that has already met their out-of-network deductible. That is not going to happen every patient or anything, but really it all comes back to the benefit verification. When we check the patient's benefit, what was the best situation there? So I hope that helps answer your question.
Excellent answer. Thank you, Courtney. Very helpful.
Mm-hmm. All right. Now I'm looking at the clock here. We're about 15 minutes past the hour, and I know many of you are on the East Coast, and it's getting into nighttime, bedtime. So we are going to wrap up the webinar for this evening. But again, any of you that have submitted some questions through the chat box or the Q&A box, we will be sure to follow up with you via email. And if you do have any specific questions that you weren't able to get in, please feel free to email us at contactus@dentalwriter.com. Again, thank you everybody for joining this evening, and Rose, thank you so much for taking the time to educate us.
Oh, you're so welcome. And again, everyone, thank you so much, and have a great evening.
Good night. Thank you.
Good night.